Mr. Speaker, as we make these changes, it's so important that people act with caution and with personal responsibility. For example, everyone should return to work gradually if they're currently working from home. They should try to meet people outside where that's possible. And it's expected and recommended that people should wear face coverings unless they're exempt in crowded indoor settings like public transport. Mr. Speaker, I also want to take this opportunity to update the House on our policies for self-isolation. Last week, I announced to the House that from the 16th of August, double-jabbed adults and under 18s will no longer need to self-isolate if they're a close contact of someone with COVID-19. Until then, with case rates are expected to rise, it's vital that we make sure our systems for self-isolation are proportionate and that they reflect both the protection given by our vaccine programme. Now, as part of this approach, we'll be working with clinicians and the NHS to explore what more can be done for colleagues in patient-facing roles. This would only be used in exceptional circumstances where the self-isolation of fully vaccinated close contacts could directly impact the safety of patients, so that we can keep our vital services going as we safely and gradually get to a closer to normal life. Mr. Speaker, the 19th of July will mark another step forward in our road to recovery. Getting here has been hard-fought and it's been long awaited, but this battle isn't over yet. Let's move forward in a confident but measured way so that we can get closer to normal life and protect the progress that we've already made. I commend this statement to the House.
I now call the Shadow Secretary of State, Jonathan Ashworth.
Thank you, Mr. Speaker, and I, of course, thank the Secretary of State for advance sight of his statement, and I want to join him and others, I'm sure, across the House in paying tribute to the England side for they did indeed unite the country, and we are indeed proud of each and every one of them. Those players did, of course, take the knee to show they were taking a stand against racism. And we again offer them our solidarity and join with others in condemning utterly the racist, vile abuse we've seen in the last 24 hours. Now, Mr. Speaker, we want to see the economy reopen in a balanced, safe and sustainable way. That means maintaining certain mitigations to both contain the speed at which infections are rising and help reduce transmission and help limit the numbers exposed to the virus before they themselves are fully vaccinated. Instead, the Secretary of State has taken a high-risk, indeed fatalistic approach, trying to gain what might happen in the winter, deciding that infections are going up anyway, and instead of caution, he's pushing his foot down on the accelerator while throwing the seatbelts off. He admits that could mean 100,000 infections a day. That means potentially thousands suffering debilitating long COVID. It means, as more cases arise, potentially more escape and the threat of a new, more transmissible variant emerging. Now, 2 weeks ago, he justified unlocking, suggesting it would make us healthier. While today, hospital admissions are running at over 400 a day. There are now 393 people in ICU, up over 100 since the start of July. And of course, significant increases in admissions knocks on to the NHS's ability to provide wider care. Now, he says the infection rates will not put unsustainable pressure on the NHS. But last week at Leeds, cancer patients were having their surgery cancelled. Last week, ambulance trusts across the country were reporting some of their busiest days ever. 111 is under intense pressure. And of course, at the weekend, he warned that the elective waiting list could rise as high as 13 million. So perhaps he could define what he means by unsustainable pressure, and could he tell us what is his prediction that hospital admissions will peak at? He's told us he expects 100,000 infections. Can he tell us how many hospital admissions he expects? And does his confidence mean that there will be no extra resources for the NHS this summer to get through this summer wave? Now, again, he highlights vaccination. But why are vaccination rates slowing down? And what will he do to drive up vaccination rates amongst younger people, where it is still only around 56% of 18 to 24-year-olds? And when will we begin vaccination of adolescents? Other countries are doing it. Why aren't we? But just to rely only on vaccination as infections climb is the approach of the one-club golfer. He needs to put other measures in place as well. So Labour, this side, would continue with mandatory mask wearing. I notice his tone has shifted actually from the last week or so, and it's now his view that it would be irresponsible not to wear a mask in a crowded room. Surely then it is equally irresponsible for the government to abandon mandatory mask wearing. Secondly, yesterday, on working from home, Susan Hopkins from PHE suggested that for the next 4 to 6 weeks at least, people should try their best to work from home. So will he guarantee that anyone who wants to continue working from home will have the right to do so? Thirdly, we know how important fresh air is. Germany has funded air filtration systems in public buildings. Now, last week he referred to the infection control funding given to social care, but that wasn't for ventilation. There are, Mr. Speaker, British firms that manufacture air filtration and ventilation units. So let's support those firms and British jobs and offer grants to premises to install air infiltration units. And will he use the summer to install air filtration systems in every school? Fourthly, as more virus circulates, more people will be exposed and more people will become ill and more will have to isolate. But some people still can't isolate because of finances. And those with caring responsibilities for someone who has had to isolate can also be financially penalised. Furlough is beginning to be withdrawn, so financial support for isolation will become even more urgent. So will he ensure that those who need to isolate can access adequate sick pay and support? Fifthly, to get through this third wave and flatten the curve, we will need ongoing testing and contact tracing will need extra capacity. Will he give local authorities resources to lead the enhanced retrospective and forward contact tracing they need to do? And will he now abandon his proposed charges for lateral flow tests, which he is set to introduce? Finally, when he was appointed, he said that any easing on July the 19th would be, in his words, irreversible. Other countries have thought the same with their roadmaps. Yet Israel has reintroduced masks. The Netherlands reopened nightclubs and had to close them again after 2 weeks. Is it still his view that the 19th is terminus day and that everything he has announced today is irreversible? Or does he agree it would be more sensible to have regular review dates in place through the summer as we deal with this third wave and rising infections?
So state.
Thank you, Mr. Speaker. The right honourable gentleman started by saying that he supports a balanced approach in a sustainable way, and that's exactly what I've set out today from this dispatch box. That is the government's approach. So I agree with him. It's just that we, as the government, have set out the detail. I'm still not sure what his plan actually is. And so, given he set out the objectives, I hope he can support this plan. And he talks about the risks that are involved, and I've been very upfront about that. The government has been upfront. There is no risk-free way forward, and while opening up is not without risk, but ongoing restrictions are not without cost. I hope the right honourable gentleman would appreciate that. He's raised a number of questions, Mr. Speaker, around hospitalisations. Was one of his first questions, and as I've said, that case numbers are going up. We expect them to continue going up, but the most important difference today versus the last wave is the vaccination, that wall of defence that our country has built, which has meant that hospitalisations, although they are rising as case numbers rise, they're rising at a lot slower rate than before. And as I've set out specifically regarding test 3 in our roadmap, that we believe that the pressure with all the data that we are seeing at this point is not unsustainable for the NHS. The right honourable gentleman talked about vaccinations, and I'm pleased he's highlighting that, especially for more young people to come forward. As I mentioned in my statement, Mr. Speaker, that we are ahead of the plans that we set out when Step 4 was temporarily pushed out by 4 weeks. And he's also asked about the vaccination of children, and he knows that we have a group of expert science advisors, the JCVI. This is something that they're actively looking at, and at some point we will reach a final decision, but I hope he will agree with me that we should take the scientific advice on that and consider it very carefully before making such a move. On air ventilation units, or some of the £90+ billion extra the government has provided to the health and care system during the course of this pandemic, some of it has gone, of course, onto air ventilation units, and we should continue to support that, and as has a lot of extra funding gone to people to support them financially if they are asked to isolate, and it's important that that is something that is both kept under review, but that is something that continues to be taken seriously. He mentioned lateral flow tests and testing, something about charging for them. It might be his policy, but it's not this government's policy. I don't know where he's got that one from, but we have no plans to charge for lateral flow tests. And then lastly, on July the 19th, what that is a step forward on our roadmap. As we've clearly set out, the pandemic is not over. It's a very significant step forward. And he talked about reviews, and I've just set out, Mr. Speaker, in September, we will have a review to make sure that we're properly set up for autumn and for winter.
Let's come to the Chair of the Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. The virus today is a totally different creature to a year ago, with only 1 in 40 new cases being hospitalised, an average age for new cases of 25, and all over 40s being offered 2 jabs, accounting for 99% of the age group that have had COVID fatalities to date. So the government's approach is entirely reasonable. But does the Health Secretary agree that there remain, to paraphrase the late Donald Rumsfeld, a number of unknown unknowns and known unknowns, not least the impact of long COVID, the potential for vaccine escape, and the potential for new variants? So will he reassure the House that if the data deteriorates beyond what is currently envisaged, he will not hesitate to take decisive action, not just to save lives, but also to head off the need for a further lockdown that will be so enormously damaging for our jobs and businesses?
Mr. Speaker, I'm very happy to give my right honourable friend that assurance. He's made some excellent points just there, and first of all, I thank him for his support for the government's action, but also he's right to point out that there is still uncertainty for us, for countries across the world in dealing with this pandemic, and I'm very pleased to assure him that if that risk matrix changes, for example, with variants of concern, we will not hesitate to take the appropriate action.
Let's go to SNP spokesperson, Dr. Philippa Whitford. Philippa.
Thanks very much, Mr. Speaker. I'd first like to associate myself and my colleagues with the Health Secretary's condemnation of the racism sadly faced by members of the England football team after their impressive performance throughout the Euros. Now, turning to COVID, the Secretary of State himself has suggested COVID cases could soar to 100,000 a day once all restrictions are removed next Monday. While research shows hospitalisation rates have thankfully dropped to 3% of cases due to vaccination, this would still mean up to 3,000 admissions, the same as during the first wave. Can he explain how he will avoid such a surge, putting pressure on health services, which would further delay clearance of the backlog of patients waiting with other conditions? With the likelihood of such high transmission rates, how does he hope to prevent the generation of yet more new variants within the UK, perhaps with significant vaccine resistance? Evidence is growing of the debilitating impact of post-COVID morbidity, and the Office of National Statistics estimate it could affect 10% of those who've had the virus. So how does he plan to avoid an unacceptably high risk of long COVID in young adults and children who are not fully vaccinated? And finally, why is he ending the mandatory wearing of masks in indoor spaces and public transport when they reduce viral spread and cause no economic detriment? Does he not recognise that as vulnerable people can't count on others wearing masks, for them the 19th of July will not be Freedom Day, but the exact opposite?
Thank you, Mr. Speaker. First, I noticed the Honourable Lady, thanks for what she said about the English football team, but she didn't say who she actually supported, so I hope it was actually England. But turning to her questions, on the hospitalisations, she's right to raise this, as other colleagues have, that of course, as cases rise, which sadly they will for the reasons I've set out, hospitalisations will rise too. But again, for a reason set out, number one being the vaccine, that the rate of hospitalisation will be far, far lower than anything we've seen before. And she will also know, given her experience, that also the treatments that are available are a lot better and effective than what we had at the start of this pandemic and during the last wave, which is also helping should people sadly find themselves in hospital. It is something as part of the three tests, test number 3, that we've looked at very carefully. We've looked at the data. Of course, we work very closely with our colleagues on an almost minute-by-minute basis in the NHS to make sure that the increased pressure, and I accept there will be increased pressure, I'll be very open about that it will be something that can be met and sustained. And it is important, though, I think, to understand that, because she mentioned the backlogs, that the backlog has built up over the pandemic because people stayed away from the NHS for perfectly understandable reasons. But we do need to start getting back to normal as quickly as we reasonably can, so that we can start looking at more people in the longer term at the NHS and actually improve the backlog more quickly than otherwise. And then on masks, Mr. Speaker, I believe I've answered that question. And the most important thing is that our guidelines are going to be very clear on masks, and they will be published later today as well.
We now come to Sir Desmond Swain.
Mr. Speaker, enterprises are having to shut because key members of staff, notwithstanding having been vaccinated twice, are having to isolate as contacts. As infections increase, so will contacts, and there's every possibility of the economy grinding to a halt. Will he review the need to self-isolate if twice vaccinated and show a negative test?
Mr. Speaker, it's precisely for the reasons and other reasons that my honourable friend sets out that we have already reviewed those rules around self-isolation, and that's why we've announced that there will be a change from August the 16th, and we will keep those under review.
Vanera Wilson.
Thank you very much, Mr. Speaker. For the 3.8 million clinically extremely vulnerable people, the prospect of a so-called Freedom Day next week is actually anything but. They and many clinically vulnerable people, such as pregnant women, are living in fear of what living with COVID means for them. Now, last Monday, the Secretary of State promised me that guidance was forthcoming. Last Wednesday, members in the other place and charities met with his ministerial colleague, Lord Bethell, and officials who admitted that this was not good enough and something more had to be done. So could the Secretary of State confirm today what support and what guidance will be forthcoming and when? Or is he pursuing a survival of the fittest policy where the most vulnerable will be thrown to the wolves?
Mr. Speaker, this is one of the most important issues, and as the Honourable Lady says, that there are many people that are immunosuppressed or severely clinically vulnerable, and it is important that every stage of dealing with this pandemic that we are thinking of them and having them front of mind, and that is what I believe we have done. Of course, where the people in that category are able to take the vaccine, they should. Not all are able to do so, but she asked about advice, and we are publishing this advice today.
We now come to Mark Harper.
I'm grateful, Mr. Speaker. First of all, it's worth saying I strongly welcome the statement from the Secretary of State. But when he's back at that dispatch box in the autumn, as I fear he may be, announcing further restrictions, guidance, or even another lockdown, one of the things that will have driven that will be hospitalisation data. There's a big flaw with that data at the moment, is that it includes anyone who tests positive for COVID who goes into hospital, not whether they've gone into hospital because they're ill with COVID. That is going to drive poor decision making. It's vital it's fixed urgently. We can't have hundreds of thousands of livelihoods and well-being sacrificed on the altar of dodgy data.
Mr. Speaker, it's an important point by my right honourable friend, and he will know, because I judge that's why he's asked the question. At the moment, the data that is available is the figures are with COVID, which doesn't make a distinction between what's causing that individual to be in hospital. So it's not precise and detailed enough. And I think that's what he's getting at. I think it's a very good point, and I have asked for advice on this, and I hope that we can start getting clearer data on this precisely for the reason he said.
7th withdrawn, which is not usual. So we'll now go to Andrew Selous. Andrew.
Primary care is not only the front line of the fight against COVID, but is also the front door of the NHS, and many staff are on their knees at the moment. Can I ask the Secretary of State to help more medical students to choose general practice and to help them stay in it? As that is absolutely fundamental to helping more people get in to see a GP easily.
Yes, Mr. Speaker, I agree with my honourable friend. My parents wanted me to be a doctor, to be a GP, and they were a bit disappointed, Mr. Speaker, but I think my mum did say she thinks my current role might make up for it. My honourable friend is absolutely right about this, and he knows our commitment to 50 million more appointments, to having more GPs, and that remains a huge priority, and I think this pandemic has made it even more important than before.
Let's go to Caroline Lucas. Caroline.
Thank you, Mr. Speaker. I join the Secretary of State and other colleagues in deploring the appalling racism shown against a football team that has shown the absolute best of our country. The Secretary of State says that caution is absolutely vital given the soaring infection rates. I agree with him, but if caution is absolutely vital, why is he weakening the measures to deliver it? The message around face masks on public transport, for example, has been downgraded from being a clear legal requirement to being an optional personal choice. As over 100 scientists and medics said last week in a letter to The Lancet, this is reckless and risks driving infections. He asks if we don't open up now, then when? Well, the answer has to be that when a far higher percentage of the total population is vaccinated, when basic public health protections like test, trace and isolate are properly functioning, when people can afford to self-isolate, when measures like air filtration systems are in our classrooms. Frankly, the government seems to be pursuing a Darwinian strategy relying on immunity by natural infection. Does he realise how dangerous this is?
Mr. Speaker, I'm afraid the Honourable Lady is just not being realistic. I think I've set out very clearly in my statement the issues around timing. No one is pretending that there is a perfect time to start lifting some of these restrictions. It is therefore something that requires a balanced and measured approach, and that's exactly what we're doing.
Sir Graham Brady.
Thank you, Mr. Speaker. Steroid inhalers of the type used by millions of asthma sufferers worldwide are known to be safe, cheap, and trials show that they are also very effective in reducing the severity and the time for which COVID symptoms are suffered. Will my right honourable friend take rapid steps to revise the guidance to make sure this becomes an immediate part of the armoury of GPs dealing with people presenting with COVID symptoms.
Mr. Speaker, when my right honourable friend wants something done rapidly, I listen very carefully to him. So I am pleased to tell him that the clinical guidelines have been published today that allow the central alerting system to recommend to clinicians and to prescribe inhaled steroids for exactly the purpose he's just set out on a case-by-case basis. I hope that's big enough for him, Mr. Speaker.
Anybody would have thought it was lined up. Dame Angela Riedel. Angela.
Thank you, Mr. Speaker. Well, I hope I'll get an equally happy response to my question. The Secretary of State has said that he's anticipating as many as 100,000 COVID infections daily. If that were actually to happen, can he tell the House how many people he and his figures we would expect to see hospitalised, and how many people he would expect to see develop long COVID as a result?
State.
Mr. Speaker, what I can tell the right honourable lady is that currently there are around 30,000 infections a day, and we have seen also in the last 24 hours in England around 400 people being hospitalised. The last time infections were around the same level at 30,000, it was, I believe, over 2,000 people a day being hospitalised. So that's what I mean about the link has been severely weakened, and for that we've got the vaccines to thank.
Steve Bryan.
Thank you very much. I look forward to having a look and scrutinising the new roadmap when it's published this afternoon. Further to the point raised by my right honourable friend Forrester Dean, I'm just trying to get clear this data on hospitalisations. I was told today of a lady admitted this weekend to a hospital in my region to give birth. She was, of course, tested on admission and was positive, so she's a COVID positive person in hospital. When does the Secretary of State think, given the advice that he's just confirmed to the House that he sought, he will be able to advise us of the figures to those admitted with COVID versus those admitted for COVID?
Mr. Speaker, I know my honourable friend speaks with experience, and again, I'm glad he's raised this point again. So I have asked for this advice because it is important that we try to better analyse the primary diagnosis of anyone coming into hospital. I can understand why in the early days of this pandemic why that was not easily possible, but I do think now we're at the stage to provide better data, and I hope I can get that done as quickly as possible.
Let's go to Sarah Owen. Sarah.
Thank you, Mr. Speaker. The recent Health Select Committee report on NHS staff burnout showed low pay as particular issues for care workers, and most NHS staff working unpaid hours on top of their contract. These are hours that could be spent with families like the brilliant student I met this morning, Brendan from Cardinal Newman School, whose dad works for the NHS. How does the Secretary of State plan to clear the backlog and fill the 40,000 nursing and 112,000 care worker vacancies if this government continues saying no to the pay rise that NHS heroes like Brendan's dad deserve?
Mr. Speaker, I agree with the Honourable Lady that the workers of the NHS, no matter what their role, they have been the heroes of this crisis, as have care workers. I think we agree on that, and making sure that is recognised is also requires us to make sure that they are paid properly. And she's right also to link this, for example, to the backlog and the huge amount of work that lies ahead. So I hope she'll bear with me, and in due course we'll set out our response to the pay review recommendations.
Thank you very much indeed, Mr. Speaker, and I welcome my right honourable friend's statement. He will know that on the 29th of April, a pilot scheme to test and release people was introduced to avoid the disruption of people who were the contacts of someone with COVID having to isolate for 10 days. He'll also know that our right honourable friend, the Chancellor of the Duchy of Lancaster, was a beneficiary of that scheme. Will he say what the results of that pilot have been and when it might be available to the rest of us, which I hope will be before the third week in August?
Mr. Speaker, I thank my right honourable friend for his support for the statement, and turning to his question, It is a very important pilot. I haven't yet seen the final results of that, but there are results starting to come through to the department. He will know that whilst that pilot has been going on, the government has also made this announcement around double vaccinated people and more flexibilities from then for those people from August the 16th onwards. But I will endeavour to say more about this and publish more data as soon as I can.
Let's go to Joanna Cherry. Joanna.
Thank you, Mr. Speaker. I've heard what the Secretary of State has said about masks today, but as my honourable friend, the SNP spokesperson, said, there will be no Freedom Day for vulnerable people if the legal requirement to wear a mask is scrapped. Now, many of my constituents have written to me over the weekend expressing concern about this issue, and like leading scientists, trade unionists and large sections of the public, they're keen for the legal requirement to wear masks in indoor spaces and on public transport to be kept at least for now. So why can't the Secretary of State commit to do this?
Mr. Speaker, I think I've set out in the dispatch box now a number of times the general approach, which is as we start to go towards a more normal, that we want to start removing the regulations, replace them with guidelines, and then ask people to follow those guidelines. And in the case of masks, for example, we've been very clear that in crowded, enclosed spaces, we would expect everyone to wear a mask. We would recommend it. And given everything and the data we've set out, the vaccination rate and everything else, we think now is the time to take this kind of more measured approach, and we will keep it under review.
Thank you, Mr. Speaker, and I very much welcome what the Secretary of State has said. On Friday, I visited Blue Bay Travel, an international travel company based in Stoke-on-Trent South, and they very much support the easing of public health restrictions from the 19th of July for those fully vaccinated. So would my right honourable friend continue to do all he can to ensure that we support jobs and industries like this, which have been hardest hit by the COVID measures, to fully recover as soon as possible?
Yes, Mr. Speaker, I can make that commitment to my honourable friend. He's right to raise this. The sector, the travel sector, has been one of the hardest hit, and I hope that as we take this measured approach and start opening up more, that's a sector in terms of both jobs and opportunities will start to benefit in his constituency and elsewhere. And I hope the company he referred to in his constituency welcome the changes we've set out so far.
Ben Bradshaw.
He mentioned the serious problems being caused in the NHS by the government's pinging system, but schools, businesses are also suffering, and now the transport and travel sector, scores of trains being cancelled over the weekend because drivers and other train staff have been pinged. So if he won't bring forward his August the 16th date, why on earth won't he continue to mandate masks on public transport, both to protect staff and passengers and give them the confidence to travel, at least up until that August the 16th date?
Mr. Speaker, the honourable gentleman may know that when we set the August the 16th date, and I think I made this clear in the statement last week, it was based on clinical advice, the public health advice that we received, especially around just it was better to make sure more people than now are vaccinated, or more than on July the 19th. And I think that's valuable advice. And when it comes to masks, Mr. Speaker, I think I've made the government's position clear.
Let's go to Mike Wood. Mike.
Thank you, Mr. Speaker. Lifting legal restrictions is a massive relief for all those who rely on pubs, restaurants and nightclubs for their livelihoods, the overwhelming majority of which are taking their responsibilities seriously at enormous costs to themselves. Does my right honourable friend agree that as we open up our society and economy, not only must all hospitality businesses take sensible steps to protect us from disease, but all customers must also play their part and respect venues and their staff who are working so hard to do the right thing?
Yes, Mr. Speaker, I agree wholeheartedly with my honourable friend. It's a responsibility as we open up, not just for the owners of the businesses, the nightclubs and the pubs, to take that sensible, measured attitude, but also for customers to give a thought about those people that are serving them at the table, serving behind the bar, and be respectful for their needs as well.
Eitel.
Last week, the Chancellor of the Duchy of Lancaster's review was reported to this House as having concluded that COVID vaccine certification was not necessary and would not go ahead. Since then, however, there seems to have been a review of the review, because the Secretary of State says that today that the Government will be encouraging businesses and large events to use certification in high-risk settings. So can the Secretary of State tell the House now what constitutes a high-risk setting in this context, and who will be the judge of what is a high-risk setting? What constitutes large events, and who will be judging what they are? What is meant by encouraging businesses, and what will be the consequences for any businesses that resist the encouragement from government in this way? And finally, how will the data that is captured in this way, that belongs to us all, be held and protected?
Mr. Speaker, the remarks that the Right Honourable Gentleman refers to by the Chancellor of Duchy of Lancaster are absolutely correct, is that as we move away from regulations, there will no longer be a legal requirement for any establishment to have COVID vaccine certification, but the guidelines, which we will publish today, will be very clear that we expect corporate bodies, responsible businesses to have a system that where we will continue to provide the infrastructure, where we would work with them and work with the respective government departments. So DCMS and BEIS are already talking to industry leaders and working with them, and it's something that actually industry welcomes, to work on a basis of guidelines rather than regulation.
Thank you, Mr. Speaker. A rate of 87% for first vaccinations is truly impressive, and it is in excess of all the estimates that I read about when the vaccination programme was first launched. But there is evidence of a worrying fall-off in people coming forward for their second vaccinations in London and the South East. So could my right honourable friend say what steps he's taking to ensure that people, especially young people, are committing to completing the vaccination course?
Yep, Mr. Speaker, my honourable friend is right to raise this. And as she says, the rate of vaccination that we have achieved in this country is the envy of the world, and that we want to make sure that is maintained. We definitely want to make sure that more young people are coming forward. So, for example, the walk-in clinics that have popped up around the country, the sort of mass vaccination events that have been taking place in parts of the country is part of that. And we are also looking actively at what other ways that we can put in place to promote the importance of vaccination.
Let's go to Janet Davey. Janet.
Thank you, Mr. Speaker. A school teacher recently told me that some families cannot afford to self-isolate. And if we're learning to live with the virus, why has the Secretary of State for Health refused to introduce proper financial support to self-isolate to ensure those who test positive can safely isolate at home?
Mr. Speaker, the Honourable Lady will know that we do have in place financial support for those who need it, that are asked to self-isolate. It is something I think that is important. It continues to be important, and it's something that we will keep under review.
Let's go to Dr. Andrew Morrison. Andrew.
Thank you, Mr. Speaker. Thanks to jabs and far better treatment, case fatality rate now is 0.085% and falling. Had it been a year ago, is there the remotest possibility that jurisdictions would have embarked upon the breadth and scope of restrictions that they did do? And does it not follow that now is the right time to move to step 4 and release burdens on people so that we can get society going? And will he please caution the opposition on their undue reliance on masks? They're not the solution. Vaccinations are.
Mr. Speaker, my right honourable friend is absolutely right to raise the importance of vaccination. That has been the key to step 4, to get us to where we are on our roadmap, and that's why I think we cannot emphasise enough the importance to continue with that programme, and that is, for example, why we set out that we plan to have a booster programme in September.
Thank you, Mr. Speaker. I have constituents who are absolutely ready for restrictions to be lifted, and I have others who are very concerned about, for example, the effect of the Johnson variant, which is prevalent in my area. So I can understand entirely the Secretary of State's desire for balance.
That balance is not provided by the Prime Minister saying one thing, usually incoherent bluster about Freedom Day or Terminus Day, and other ministers, such as the Secretary of State, saying others about the need to continue wearing masks. Will he understand that the continued mixed messaging from government is not helping us to get through this crisis?
Mr. Speaker, the government is speaking with one voice, and I believe our view is very clear.
Christopher Cho.
Mr. Speaker, tomorrow my right honourable friend is going to be asking the House to approve regulations which will put thousands of care workers in England out of a job. 2 weeks ago, we were promised that a regulatory impact assessment was available. As at midday today, that regulatory impact assessment is still not available. When will it be available, and why hasn't it been made available so far?
Mr. Speaker, I believe my right honourable friend is referring to the measures the government has already announced around vaccinations and people who work in care homes. I would like to ideally make sure that impact assessment is available. I do understand, and I don't know the full detail as to why it has not been completed, but at the same time, I do think it is important to get on with this part of building our vaccine wall, and we will have more to say about it tomorrow.
John Speller.
Thank you, Mr. Speaker. And the Secretary of State will be aware that Singapore has announced its plan to navigate from pandemic to endemic and to coexist with the virus. They could almost have been reading my speeches and articles, Mr. Speaker. But so will he get the economy and society moving again, and in particular take a fresh look at vaccine passports or certificates, including the vaccine card, after all, that we all carry? Minister, let's allow our people to get back to normality.
Well, I take it by that, Mr. Speaker, that the honourable gentleman supports the measures that I've set out today in this statement, and I thank him very much for his support.
Julian Sturdy. Julian.
Thank you, Mr. Speaker. I very much welcome this statement today on the back of the successful vaccine rollout programme. However, given the rising numbers of people having to isolate and the impact this is having on businesses and our economy, can I reiterate the call to my right honourable friend to consider bringing forward changes to the requirement to isolate after contact with a confirmed case for those that are fully vaccinated? There has to be a better way forward that doesn't have the economic impact that the current isolation policy is having.
Mr. Speaker, I do understand the importance of the point my honourable friend has made. And as I said earlier in response to another question, that the date of August the 16th is based on the best advice that we can get at this point in time. He may be interested to know that there's, as well as the test and trace system, there is also the app, the NHS COVID app, and a number of people have referred to the so-called pinging. And I do want to take a careful look at this to make sure that also can provide a more proportionate and balanced system given the rate of vaccination.
Thank you, Mr. Speaker. These are understandably concerned amongst those who are immunosuppressed, and particularly those with blood cancers, about the effectiveness of vaccines. And I know that the Secretary of State mentioned this earlier on. Can you be really clear? Are the vaccines working? Will they get booster doses early? And when will very detailed and specific advice for the whole range of conditions, and I declare an interest on this as somebody with in my own family and indeed many constituents, when will they get that clear advice so that that concern can be put to one side?
So, State.
Mr. Speaker, again, the honourable friend is right to raise this issue. The vaccines are working, and I think I've set out clearly why, and the government has published much evidence of that. In terms of the booster programme, which begins in September, the immunosuppressed and clinically vulnerable will get priority in that, and they will be in the initial cohorts. And the advice that I referred to earlier will be published today.
Lynn Saxby.
Mr. Speaker, under what circumstances or conditions does my right honourable friend consider it will be responsible to work in crowded spaces such as in retail, in hospitality, or indeed even in this place without wearing a mask?
Thank you, Madam Deputy Speaker. I think my honourable friend is right to raise this, and that's why our guidelines on mask wearing will be very clear that if people are in retail spaces and they're crowded, and certainly, as we know, most of them are enclosed, that they should consider wearing a mask, and that also they should not just be thinking about those themselves, but also the people around them and the people serving them.
Now we go to Catherine McKinnell.
Thank you. The Secretary of State will have seen the huge and rising number of COVID infections in the northeast, and the decision to remove controls will clearly accelerate that and increase concerns about the short and long-term impact of COVID and the risk of vaccine-resistant variants. But regardless of the proposed COVID passports, businesses in the northeast, especially in sectors like hospitality, where there are large numbers of young, unvaccinated people who work, they're already struggling to function with reduced staff and customers cancelling at the last minute to self-isolate. So with the government withdrawing economic support at the same time, does he appreciate the concerns that for many hospitality businesses, the government's summer of high COVID may be too much to survive?
Madam Deputy Speaker, the Honourable Lady will know, first of all, there's still significant economic support in place, and of course it's the job of the Treasury to keep that under review. And when it comes to self-isolation and the impact that has on businesses, it is important that now that we have such a high level of vaccination, including in the northeast, that we can take a more proportionate and balanced approach, and that is exactly what we're doing.
And now we go by video link to Jacob Young.
Thank you, Madam Deputy Speaker. I think it's great news that we're moving back to personal responsibility next week, and I thank the Secretary of State for that. However, rates are increasing in Redcar and Cleveland, and while hospitalisations are not climbing in the same way, my concern is that more and more people are having to self-isolate due to the dreaded ping from the NHS app. We all remember the difficulties of last year where people struggled to get a test. But since then, the government's massively increased the testing capability available, and getting a test is no longer an issue. What more can be done to utilise this immense testing capability to prevent people from having to self-isolate unnecessarily?
Mr. Speaker, Madam Deputy Speaker, what I will say to my honourable friend is that, again, he's right to raise this, that the so-called ping, it does serve a purpose. It has served a huge purpose as we've been dealing with this pandemic, particularly during the last wave. If someone is pinged, it might certainly be very useful information to them if they were planning, let's say, in the days ahead to visit a vulnerable person, perhaps a grandparent or something. So I think it's valuable information to give people. But as I've said earlier, that I do think we can look at the approach and make it more measured, given the high rate of vaccination, and then also, as he suggested, make more use of tests, which is exactly what we are doing.
Now we go by video link to Mike Amesbury.
Thank you, Madam Deputy Speaker. What assessment has the Secretary of State and its department made on the number of children with long COVID, and when will children get vaccinated?
Madam Deputy Speaker, when it comes to children and COVID, and the Honourable Gentleman has asked about long COVID, there is a huge amount of research being done both within the NHS and in my department. And I mentioned earlier, for example, the extra £50 million of funding that we are providing to do even more research and to step this up. As the Honourable Gentleman knows, long COVID is a problem the world over, and that I hope the UK can become a world leader in trying to help with this problem and share the research it does with other countries. In terms of vaccination of children, as I said earlier in response to a similar question, the JCVI is actively looking at this issue, and once we have their final advice, we will set out our plans.
Mark Jenkinson.
Thank you, Madam Deputy Speaker. I welcome my right honourable friend's confirmation on the return of our freedoms. Knowing what we do now about the impact of some of our interventions, we must never return to those dark days. While we've taken a huge backward step in this regard, does he agree that we should use this great unlock to usher in a new era of personal responsibility? Perhaps we could start with a review of Clause 125 of the Health and Care Bill, which would appear on the face of it to prevent UK food manufacturers advertising their products anywhere online, not just in the UK, while conferring advantage on huge globally recognised brands.
Madam Deputy Speaker, obesity is a real problem in this country and others, and the causes of it are very complex, but we do want to make sure that we have the best approach possible. My honourable friend will know that we are planning to debate this bill on Wednesday, and I look forward to seeing him in the debate.
Patricia Gibson.
Thank you, Madam Deputy Speaker. I want to press the Secretary of State a little further on wearing masks. He has said that he has been perfectly clear, but the opposite is the case. His government was dithering on mask wearing on this very week last year, and the dithering and mixed messages continue. He tells us that masks will no longer be compulsory, but wearing them will be expected, as the Chancellor boasts that he will stop wearing a mask on the 19th of July. The Chief Government Medical Officer and the Chief Scientific Advisor say they will continue to wear masks. Why has this important public health tool been so undermined by the dithering and mixed messages of his government?
Secretary of State.
Madam Deputy Speaker, I believe I've answered this question a number of times during this session.
We now go by video link to Andrew Gwynn.
Thank you. It's 16 months since I contracted a fairly mild bout of coronavirus, which unfortunately developed into terrible long COVID, and the symptoms still persist all these months later. Look, the vaccination programme has been a game changer, and I want a return to normality like everyone else. But does he understand that the consequence of his decision may well be more people with long COVID? The money for research is welcome, but what more is he planning to do to support those with long COVID with health, rehabilitation and social security measures, and to support employers with the reality that sections of their workforce might be unfit for work for periods too?
State.
Madam Deputy Speaker, first, if I can say to the honourable gentleman, as I've said a number of times during this debate, that opening up is not without risk, but I hope the honourable gentleman understands that keeping restrictions in place is also not without cost. So the government has to take a balanced approach. He's right to raise the issue of long COVID. As I mentioned earlier, this is something the government takes very seriously. I've announced another £50 million of funding of researcher into this, and he's right to raise this. This is a problem not just in the UK, it's an issue the world over. We still don't know enough about long COVID. I think it's fair to say we are learning more all the time, but it will be an absolute priority of this government to work with people with long COVID and do everything that we possibly can.
Holly Mumby-Croft.
Thank you, Madam Deputy Speaker. More double vaccinated people than ever are being asked to self-isolate because they've come into contact with someone who is positive for COVID. This is really incredibly difficult for individuals and families, and of course disrupts jobs and businesses. And I've heard cases of people being asked to self-isolate more than once in the same month. So can I add my voice to others across this House and ask my right honourable friend, the Health Secretary, to consider bringing forward some form of test and release measure for people who are double vaccinated before the 16th of August?
Secretary of State.
Madam Deputy Speaker, again, this is an important issue, and my honourable friend may have heard the response I gave earlier about the test and release scheme. That is something that I'm eagerly waiting to look at the result from and see if we can provide further flexibilities. But I hope she would also welcome some of the flexibilities that we already announced, including the changes that would take effect on August the 16th.
And now we go by video link to Debbie Abrams.
Thank you, Madam Deputy Speaker. Can I take the opportunity to condemn the vile online racism against some members of the England football team yesterday after they'd given their all for their country? But Madam Deputy Speaker, the World Health Organization has expressed their concerns about rising infections in England and the risk to the 17 million people who still remain unprotected by vaccination. But even those who have been vaccinated are at risk of long-term illness and disability if they become infected. ONS data indicates that 1 in 7 infected people of working age will experience ill health after 12 weeks. So can I follow up on my honourable friend, the member for Denton and Reddish, in chasing the Health Secretary on what his estimates are of the incidence of long COVID as a result of this third wave, and what discussions he's had with the Work and Pension Secretary about what this means if they're unable to work in terms of support through the social security system.
Madam Deputy Speaker, the Honourable Lady raises the importance of vaccination. She's right to do so. I mentioned earlier that according to the ONS, 9 out of 10 adults in this country have antibodies, which is part of that wall of protection. She's right to mention that the cases will rise in this wave. We've been very open about that. But I hope that she heard earlier in my statement that there is no perfect time to start opening up, because the risk is if we don't do it now and we wait until the summer, the schools will be back. If we wait longer, it will be winter, and there's a real serious risk that we've been advised on that the wave could be even bigger than what is anticipated at this point, and many more people will then end up getting affected and thereby extension getting long COVID. So I hope that she can consider all of this together in a balanced way, and if she would like to meet with any of the ministers in my department or officials to understand this better, I'd be happy to arrange that.
Craig McKinley.
Thank you, Madam Deputy Speaker. From previous answers given, I'm delighted my right honourable friend is now looking at the underlying settings of the Track and Trace app. Could I ask him to do this as a matter of some urgency, because it takes no account of vaccination status or any other behaviours. It's just a blunt Bluetooth signal. And whilst it might have had value when we had few other tools in the box, to now be condemning potentially millions of people to unnecessary self-isolation and the economic impact thereon now must be perceived to be highly questionable.
Secretary of State.
It's an important point, Madam Deputy Speaker, and I hope my honourable friend would have noted earlier that I've said that precisely for the reasons that he set out, that given the high rate of vaccination, we are taking a fresh look at the app. I've asked for advice on this. I've just started to receive some of that advice to see how we can take a more proportionate and balanced approach.
Now we go by video link to Paul Blomfield.
Thank you, Madam Deputy Speaker. It's clearly right to take further steps towards unlocking, but it's not the all or nothing choice the Secretary of State has suggested, and vaccines are not the only tool available. Wearing masks in enclosed spaces reduces infection and therefore hospitalisation and death. It's supported by health experts and it's backed by the public. The reasons it was made mandatory remain the same as when the government recommended it those months ago. So with hospitalisation up 34% on a week ago, will he not put public health before the pressure from his more vocal backbenchers and retain mandatory mask wearing for public transport and other enclosed spaces?
Madam Deputy Speaker, where I agree with the honourable gentleman is that it's not all or nothing, and that's why the government's been very clear that as we start opening up, there are other measures which will rightfully stay in place. I've mentioned earlier the border controls, the test and trace system, the plan for booster vaccines, and I hope that's something the honourable gentleman would welcome.
Robin Miller.
Thank you, Madam Deputy Speaker. In Aberconwy, I've had the privilege of seeing some of the terrific work being done by Betsy Cadwallader Health Board on the delivery of a UK vaccine across North Wales. Does my right honourable friend think that the pandemic has shown us, perhaps reheated or reinforced the importance of working together on health matters? And does my right honourable friend agree with me that UK governments and devolved administrations should now explore opportunities of working together on better health outcomes for all UK residents in all parts of the UK?
Yes, Madam Deputy Speaker, I agree wholeheartedly with my honourable friend that what we have seen during this pandemic is by working together on public health, or all types of public health issues during the pandemic, but especially on the vaccine and the delivery of the vaccine, we are stronger together, and we should draw some long-term lessons from this about how that we can utilise some of that for not just protecting against future pandemics, because sadly they will be some, but how we can look at other public health issues that we collectively face and just find a way to do a better job together.
Vicky Foxcroft.
Thank you, Madam Deputy Speaker. I've written to the Secretary of State urging him to do everything he can to protect immunocompromised people as restrictions are eased. We urgently need the results of the Octave study into the efficacy of COVID-19 vaccines on this population. When will we get this? And in the meantime, will the government provide antibody tests for immunocompromised people, allowing them to make informed decisions? Better communication and proper support will go a long way towards alleviating escalating levels of concern.
Madam Deputy Speaker, regarding the study that the Honourable Lady has referred to, I will look into that and I will write to her if she'll allow me. And in terms of the immunocompromised people and what we can do, it's come up a number of times during this statement, and I would just guide her to the comments I already made, but also just to highlight again that we will be publishing some guidance on this today.
Robbie Moore.
Madam Deputy Speaker, I welcome my right honourable friend's statement, but can I add that last week I heard from a self-employed small business owner in my constituency of Keighley and Ilkley who has been told to self-isolate 3 times in the last 2 months despite not testing positive on any of these occasions. This is both impractical to the individual but also harmful to our local economy. So can my right honourable friend assure me that he is exploring all possible options to remedy this, whether that be through adjustments to the NHS app or changes to the self-isolation rules?
Madam Deputy Speaker, the app and the sort of so-called pinging, and my honourable friend has referred to an individual in the constituency that's perhaps been pinged too many times. That it is right, as I've said, that we take a fresh look at any changes that we can make to that in light of the mass vaccination campaign, the success of that campaign. And if my honourable friend will bear with me, I think he will be pleased with our course of action.
And finally, Kevin Jones.
Madam Deputy Speaker, in response to my honourable friend, the member for Chester, he said the government speaks with one voice. Well, clearly on masks it changes in response to whatever the latest YouGov poll says. But can I ask him, he's been very clear today that people should wear masks in confined spaces. So can I ask him a direct question? What is his advice to retailers? Should they insist on their customers wearing masks when they enter their shops?
Madam Deputy Speaker, our guidance that we'll publish today will be very clear on that.
Thank you. Point of order, Sir Christopher Chope.
This point of order arises directly out of the response that the Secretary of State gave to me, because tomorrow this House is being asked to approve the Health and Social Care Act 2008 Regulated Activities Amendment Coronavirus Regulations 2021. When that instrument was laid on the 22nd of June, the explanatory memorandum said, and I quote, "A full impact assessment of the costs and benefits of this instrument is," I put the emphasis on is, available from the Department of Health and Social Care and is published alongside this instrument. As at 12 o'clock today, I've been trying through the good offices of our excellent colleagues in the library to get an answer from the department as to when this we were going to get this impact assessment. And the officials at the DHSC are quoted by the library as having said the impact assessment has not been laid yet. We knew that. We will be laying it at the earliest opportunity. Madam Deputy Speaker, this is very serious because the Secondary Legislation Scrutiny Committee on the 6th of July referred to the impossibility of being able to scrutinise this legislation properly without the impact assessment, despite that Secondary Legislation Scrutiny Committee recommending that the debate be deferred. Nothing has happened, and all that the Secretary of State has said in response to me was, well, we don't know where it is, but don't worry about it, we'll carry on tomorrow anyway. That is just not good enough, and I'd be grateful for your guidance as to what we can do to ensure that we have an informed debate with the impact assessment before us.
Further to that point of order, Mr Harper.
Well, just to, obviously intending to be helpful to the Treasury bench, I've noticed looking at the said regulations that they don't actually come into force for 16 weeks until after they're made and approved by the House. So it would seem to me, it's 4 months, Madam Deputy Speaker, there's plenty of time for the government to produce the relevant information for the House to take a decision with no detriment at all to the health and safety of anyone in our care homes.
Well, I thank both right honourable gentlemen for their points of order, which I'm sure the House is well aware is not a matter for the chair, and I'm not going to spring it on the Secretary of State to give an answer on this operational matter, but Mr. Speaker does usually observe that it is helpful to the House to have as much information before members when a matter of importance is to be considered. Well, further to that point of order.
That is that we've had this explanatory memorandum which falsely asserted that a full impact assessment is available. Why was the House misled in that way?
Once again, the honourable gentleman knows that I cannot answer that question because what is said by ministers and their departments is not a matter for the chair. But if it were to be the case that a spokesman for a minister had suggested that something had happened which had not happened and upon which members were trying to rely and could not rely, Mr. Speaker would take a very dim view of that, and it is better if ministers make sure that their departments give as much information to members ahead of discussions as is possible. Is it further to that point of order, Mr. Ashford?
Deputy Speaker.
Point of order.
I rise to reinforce the point from the Honourable Gentleman and the Honourable Gentleman from the Forest of Dean. What the House is being asked to decide tomorrow is whether to proceed with compulsory vaccination for a certain section of the healthcare workforce. We've never had compulsory vaccination in this country since the 19th century when it was tried and then abandoned. This is an incredibly serious intervention. Is there a procedure by which the House can delay coming to a decision tomorrow until this assessment is published?
I don't believe there is such a procedure, as the matters which are on the order page